Hi everyone, it's Jim at whatsmedicare.com. Today we're going to go through some of the basics of Medicare so that everyone here has a better understanding of how Medicare works and how it pertains to your particular situation. Okay, now I'm going to tell you a little about myself because that's important. I'm a certified senior advisor as well as a long-term care consultant. I've been doing this since the late 80s actually, helping individuals just like yourself with all kinds of questions on Medicare, how does insurance work, things like that. The good news for you is that I'm not affiliated with any government agency. I'm not part of Medicare or CMS or Social Security. And our goal, as always, is helping our clients mitigate health insurance costs in retirement. It's so important to make sure you understand the gotchas of Medicare and long-term care planning. So now we're going to talk about today's agenda, which is important. So we're just going to go through some of the basics, and you can see it just popped up there. What is Medicare? When to enroll, right? What different enrollment periods, and who needs to enroll? What if you're still working and you're on the company group plan? What about Medicare and COBRA? So misunderstood and so important not to mess up, that's for sure. And I've got some great slides on the A, B, C's, and D's of Medicare. We're going to go over some of the insurance options by going through some of the Medicare supplement and Medicare Advantage type plans, and also what's not covered by Medicare. So important. So we're going to talk about what is Medicare. It's our national health care plan for people 65 and over, or if you're under 65 with certain type disabilities, you're eligible for Medicare normally after 24 months. And you can see on the bottom right, that's what the new Medicare insurance cards look like. They've got your name on there, and they changed. They used to have your Social Security number plastered on the front, which wasn't good, and now they've changed it to an 11-digit encrypted number. So if you are a friend or your mom, dad, grandparents, aunts or uncles or neighbors have an old card in their pocket with their Social Security number on it, they need to call 1-800-MEDICARE. It's really simple, 1-800-MEDICARE, and order a new card. So what the government does is they require everyone 65 and older to get this plan, or they fine you. That's how they get your attention. But we're going to talk about the one exception. So let's talk about that exception, right, for Medicare enrollment. So we know everybody must enroll into Medicare when you turn 65, or you're going to pay a fine, right? That's not good, so we want to prevent that. But there is an exception. For most of you viewing this today, you're working for an employer that has more than 20 employees. That's the key. If there's more than 20 employees, guess what? You or your spouse, and if you're covered by the employer group plan, you don't have to enroll for Medicare. You have options. So regardless of what your brother-in-law, your coworker, or your neighbor tell you, listen, you're going to be okay. So don't be influenced by people. All too often, there's so many people trying to help you, but they're giving you disinformation. What's important to understand are the enrollment periods. That's where penalties come into play with the government. So we have to make sure that you're good to go with that. And we're going to talk about Parts A and B of Medicare and the 3 times you can enroll. The first one is your initial enrollment period when you first turn 65. The government gives you a 7-month window to enroll for both Parts A and B. So let's do an example real quick. Let's say your birthday is April 16th of this year, and you're turning 65. That means you were born in 1956. Government says you can enroll 3 months prior to your birthday month. So we know if your birthday month's April, you can do it as early as January. You can enroll into April and 3 months after. So you have a 7-month window. That's called your initial enrollment period. Second time you can enroll is a special enrollment period, and that's especially important if you're coming off of group health plan. You have options. As long as you do everything correctly, you're going to be okay. The third enrollment period I put on there, it's called the general enrollment period. That means bad. That really means that's not good, okay? You're going to be probably subject to fine if you don't do it. So if you're not working for a company with more than 20 employees, let's say you're self-employed, you're working for a small company, maybe of 10 employees, you must sign up. If you don't, you're going to have to wait till the general enrollment period, and that's not good because there are late enrollment penalties involved, and they last forever. So we want to make sure we avoid that at all costs. So now we're going to talk about the penalties and what if you don't enroll on time. Well, that's not a good thing. If you miss that, the initial or the special enrollment periods, they make you enroll during the general enrollment period. So it's not when you decide you're going to. You have to wait until January 1 to March 31st of the following year, and coverage is effective July 1. And that's not good normally because it's going to make you subject to late enrollment penalties, and these penalties last a lifetime. You can see on the screen here what they are, but we just want to make sure that doesn't happen to you. And there's one key slide at the end here. I'm going to have my contact information where you can email me or call me so we can make sure that does not happen to you. So let's talk about signing up for coverage because that's totally misunderstood. So the most confusing thing about enrolling for Medicare is that there are no Medicare offices out there. So if you go out and start looking for Medicare offices, there are none. Social Security handles the enrollments for Medicare, which is the confusing part. CMS is the Centers for Medicare and Medicaid Services, and they're the administrator. So when you turn 64, 64 and a half, you want a national database, and you're going to get bombarded by advertisements for every insurance company out there. Some look very official, look like they're coming from the government, but they're not. They're advertisements. If you get anything that says CMS on there, you want to make sure you keep that and open it. So where do you sign up? You can do it the easiest way is online. You're going to go to the Social Security website, which is real simple. It's ssa.gov. You can also call them. There's their 800 number. And normally you can always have a visit to your Social Security office, but because of COVID, you want to make sure and check with them to see if that local office is open. And here's something really interesting. I have a lot of people come in and go, Jim, I've got my Medicare card. How did that happen? Well, that tells me you're already receiving Social Security or Railroad Retirement benefits. That's the only way you're going to be automatically enrolled. If not, the government says, listen, that's up to you, and if you mess it up and don't do it properly, we're going to fine you. Now we're going to talk about your insurance options. What do you do after you get Medicare Part A and B? We've got a couple insurance options, and we're going to take a look at both of them. First one is, if you've got original Medicare, which is that red, white, and blue card right there, you can now, it consists of two parts. Part A is the hospital side. Part B is the medical side. Outpatient surgery, urgent care, all that kind of stuff is covered under Part B of Medicare. Well, most people, when you have original Medicare, can go to any doctor, hospital, provider throughout the United States or its territories. Remember, this is better than a PPO because there's no list. You can now go to any centers of excellence with original Medicare. So many hospitals, probably 99% of all hospitals and facilities accept Medicare, and 94% of all physicians nationwide take Medicare. Well, most people, when you have original Medicare, there's gaps in co-pays and co-insurance. So most people purchase some type of a Medicare supplement policy that's going to take care of all those gaps in co-pays. And also you're going to have to add a Part D prescription drug plan. And we're going to talk about that in a few slides here. But the second option are the Medicare Advantage plans, better known as Part C of Medicare. And also every time you turn on your TV and you see an advertisement and they mention an HMO or PPO, that's what they're talking about. These Medicare Advantage plans are pretty nifty actually. Everything's kind of in one package where you get your health, and they also normally include the Part D plans. But we're going to talk about something you have to be very cautious of when you enroll for the Medicare Advantage plans. Now we're going to talk about what if I'm over 65 and still working? Or what about my spouse if she's over 65 and she's still on my plan? What do I need to do? What are my options? And the next slide, we're going to look at 3 options that you all have. So now we're going to talk specifically about group health plans in Medicare. Right now we're going to focus on group plans with more than 20 employees, which most of you, it probably pertains to most of you on there. Most companies have more than 20 employees. So what are your options? Well, Medicare says, listen, you can stay on that group health plan as long as you want, because that kind of helps protect Medicare, because your group plan is the primary payer right now, meaning if you have a claim, they pay first. If you want to sign up for Part A only of Medicare, that's an option. Part A is the hospital side. The reason why they recommend it, it's premium free. It doesn't cost anything. And if you have a claim, let's say you're inpatient in the hospital, we know that your plan is the primary payer. So if you have some kind of deductible, copay, or coinsurance, and you have Medicare as a secondary payer, they can come in behind there and pay a portion or some of the deductible. So it can't hurt you in any way. But, and here's a big but, is that if you are participating in a health savings account and an HSA, you cannot enroll for even Part A of Medicare. So that's a gotcha. You got to make sure that you don't make any HSA contributions. Lastly, you could say, well, listen, I think I want to come off and go on to Medicare and do my own thing. You have the right to do that. Your employer must offer you the same plan as anybody under 65, but that doesn't mean you have to take it. And lastly, let's talk about group plans with less than 20 employees. So if somebody listening is self-employed, maybe you're a realtor, sole proprietor, whatever it may be, you work for Joe's Tire Shack with less than with 10 employees, then guess what? You must sign up for Medicare Parts A and B. It flip-flops where Medicare becomes primary. So you absolutely need to do that. So regardless of what your brother-in-law, your neighbor, or coworker tells you, you must. And I'm going to have all the information to get a hold of me if you have questions later on. Now we're going to talk about COBRA, and there's something really important you need to understand about COBRA. Most people, when they leave their job under 65, they're eligible for COBRA, and that's awesome, right? You can get your benefits from up to 18 months to 36 months. It depends on the size of the company. But let's talk about specifically with Medicare. Medicare looks at if you did COBRA and continuation plan, they don't consider that group health coverage. Why is that important? Well, because you're not eligible for a special enrollment period. A special enrollment period, we talked about that briefly. So if you leave your group plan and you enroll for Part A and B of Medicare, there's no type of fine as long as you do it within a certain time frame. But people that go on to COBRA for 18 months and they go to sign up, they're going, gee, I'm sorry, that wasn't an eligible group plan, so you are not eligible for a special enrollment period. You could be subject to late enrollment penalties. You'll want to check out the Medicare and You guide on Medicare.gov. And remember, if you are on COBRA, you do need to enroll for Medicare Parts A and B because that becomes a primary payer. COBRA is not the primary payer. That insurance company is not. You must have Part A and B of Medicare. I'm sorry. So now we're going to talk about HSAs and group health plans. And I've got some frequently asked questions here because these are the ones I get all the time. So hopefully it answers most of your questions. Do I lose my HSA eligibility at 65? In other words, if I don't sign up for Medicare, can I keep contributing to an HSA? And the answer is yes. On the other hand, if you enroll in Medicare, you cannot make HSA contributions. A lot of people want to know if I'm automatically enrolled in Medicare Part A at age 65. And the answer is no. You must enroll unless you're on Social Security or railroad retirement benefits. That's the only way you get a Medicare card. So if you want to enroll in Part A, you must do that through Social Security website. What about can I continue to contribute to my HSAs once I'm enrolled in Medicare? Again, the answer is no. You cannot do that. Can I contribute to my spouse's HSA if I'm enrolled in Medicare and no longer HSA eligible? Yes, as long as your spouse is not on Medicare, they can do that. If I'm no longer HSA eligible, can I make income tax-free distributions for qualified medical expenses? The answer is absolutely yes, you can, and they're eligible for Medicare eligible expenses. Given the penalties, should I enroll in Medicare Part A and B? And the answer is no, you should not do that. You really, if you're going to do that, you want to talk to your tax advisor, your CPA, and find out because it's really a personal decision and you've got to weigh the options if that penalty is going to be worth it or not. All right, now we're going to talk about the 4 parts of Medicare, and we're going to talk about Part A first. That is the hospital side. If you go inpatient in the hospital, skilled nursing, that's covered in Part A. Again, there's no premium for that. Next, we have Part B. That's the medical side, the doctor side, and there is a cost to that. And we'll go over that. I've got a slide on all this, the cost on that for 2021. Next, we're going to talk about Medicare Advantage plans, the HMO type plans you see on TV all the time that include the benefits of both Part A and B as well as the prescription drug plan all combined into one plan. And lastly, Part D prescription drug plans. We'll go over that and why it's so important to understand if you don't enroll, you may be subject to penalty. Now we're going to talk about Part A of Medicare, otherwise known as the hospital side, right? Helps cover you if you're inpatient in the hospital. If you need skilled care right after you come out of the hospital and you need skilled care, not long-term care. You need to understand that Medicare does not pay for long-term care. No custodial care, skilled care only. Hospice, end of life, is also covered under Part A. Some home health care when you come out of the hospital. You can have coverage at home depending on the situation. I always get, how much does Part A cost? Well, it's premium free, but it's really not free at all if you think about it. Most people, when you're working, every time you get a paycheck, you look down at that little Medicare tax. 1.45% is coming out of your paycheck every time you get paid, and the employer matches that amount. So there's nothing free about it. You've simply funded it in advance. So now let's talk about Part B, the doctor side, the medical side of Medicare. It covers you for all your medical services, supplies, doctor bills, lab work, x-rays, MRI, CAT scans. You can go to Medicare.gov. They've got a great list there of everything that's covered under Part B. Essentially, they're medically necessary services of a doctor, and it's covered, doesn't matter where you see the doctor, whether it's in his office, urgent care, if somebody's in a nursing home for outpatient surgery, that's covered under Part B. Even telehealth now is covered under Part B. But we're going to go into the prices for Medicare next, but just on the coverage itself. So if you have Part B only and you don't have any type of supplemental coverage and you have a claim, you're going to pay the first $203. That's the Part B deductible for 2021. And then next it's an 80-20 plan, meaning the government pays 80 and you're going to pay 20%. But 20% of a large number, if you have outpatient surgery, for example, it's a $50,000 bill and you're paying 20% of that, that's a big claim, and that's a lot out of pocket. And here's what you have to worry about. There's no cap, right? There's no cap. Most of your health plans now that you have when you're under 65 have some kind of out-of-pocket maximum. That's what they refer to it. If you just have original Medicare with no insurance, you don't have that benefit, so you're out of luck. You have to pay whatever the 20% amount is. So now let's go over the Part B premiums for 2021. You can see in the top right corner there the monthly premium. For most people, I think about 94% of the population, it's $148.50 a month. If you're on Social Security, receiving Social Security benefits, they automatically take that out of your payment every month. If not, they simply bill you quarterly. And you can see the brackets now that they charge for higher earners, both for the individual return and the joint tax return. So the government does a 2-year look back at your modified adjusted gross income to determine which bracket you're in. So for example, for 2021, they're looking at your 2019 tax return. And if you have higher income than the first threshold, guess what? They charge you what's called an income-related monthly adjustment amount, an IRMA. So those aren't good, but that's just the way it is. It's an extra tax. And here's the penalty too I put up there. It's 10% for each 12-month period you should have signed up for Part B but didn't. So you want to make sure and avoid any late enrollment penalties. Now we're going to talk about Medicare Advantage plans, otherwise known as Part C of Medicare. Medicare Advantage plans normally have initials like an HMO or PPO. They're ones you see advertised on TV all the time. They're very low premium, no premium. They're offering you all the benefits in the world to enroll. In order to take a Part C plan, you must have both Parts A and B. And Medicare actually sponsors these plans. That's why they can charge zero premium sometimes. I mean, think about it. The insurance company is funded by the government to go ahead and offer those plans at a very low cost. And that's why people like them, right? It's easy and low cost. An HMO, I go to my doctor, make a copay, go to the local hospital. And most all the plans include Part D prescription drug coverage. It's built in. You can also change plans every year during the open enrollment period or the annual election period. It means the same thing, between October 15th through December 7th. So if you sign up for company ABC and you want to change to XYZ, you can do it during that time frame. But one thing you have to remember, all HMOs work the same, where you have a primary care physician and he refers you to within the medical group that he's in certain hospitals. But the big R that popped up there, you need to understand they're restrictive. Remember we talked about original Medicare, you can go to any doctor hospital that you want to that accepts Medicare. Not with Part C plans. You must stay within the network or you're going to pay higher copays or may not even be covered. Now we're going to talk about the last part of Medicare, Part D. Part D stands for prescription drug plans. You've got to have both parts A and B, and government requires the insurance companies to offer you a certain level of coverage. It's required by all the insurance companies doing it. The government doesn't offer these plans, but they're run by private insurance companies. The caveat is you can look up all the prescription drugs on the Medicare website, which is medicare.gov, to see which plans may work best for you. You can also change the plans during the open enrollment every year between October 15th through December 7th, so you're not stuck on any one plan. If it changes, if your prescriptions change over the time of next year or the next couple of years, you can also change. And unfortunately, Part D plans are now subject to the extra tax, the extra IRMA, just like Part B. So now just a brief review of your insurance options. Right after you get your Medicare card, you can, which is original Medicare, you can say I want to go and purchase a supplement, a Medicare supplement plan, as well as a Part D plan, or your other option is to simply go to a Medicare Advantage plan, an HMO type plan, right? That's the Part C plan we talked about. And it usually includes your Part D prescription drug coverage. Just a brief review for you. So let's talk about some things that are not covered by Medicare that most people assume that they are covered, right? Medicare does not offer vision or dental. They don't do hearing aids. They don't do private duty nursing. And most importantly, they do not cover long-term care. They do not. I get asked that by adult children all the time about their parents. They do not. You can see on the left side there that healthcare is really focused. It wants to get you healthy and back on your feet. Long-term care is more about caring, right? It's not about curing. Most people have chronic type conditions. Skilled care is covered for Medicare. So when you come out of the hospital, if you've been in 3 midnights and discharged on the 4th day, skilled nursing care kicks in under Part A. But just so beware, that does not cover custodial type care. It is not covered. So once it goes custodial, Medicare says we don't cover that. What a good segment into long-term care planning, because as we know, Medicare does not cover long-term care, custodial type care. It does not. Most people automatically choose this. They kind of default to this option where they self-fund. You've got CDs, savings accounts. You may say, I'm going to use my IRA, set aside it for care. But guess what? After that money's gone, then what do? In California, Medi-Cal is an option, but it's very limited, right? Most people use that if they've exhausted their money or their assets and they can qualify for Medi-Cal, and that may help. The last thing is insurance, but quite honestly, who wants to go buy a long-term care policy, right? Not many of us want to run out there and buy one, but you have to know this. There are new options out there, and I've helped so many clients with them. It's a new type of product. They use life insurance with long-term care benefits built in. The reason they do that is the policies are guaranteed. They have guaranteed living benefits, so you can access the care for long-term care, for example. If you pass away, you get a tax-free death benefit. So there's lots of new options out there, and you owe it to your family to check these out. Remember, it's not about you, it's about them. They're the caregivers, and they're the ones that it's really going to be hard on. This slide is easy. Listen, we went over a lot of material. It's not easy. I've been doing this since the late 80s, and our office really specializes in helping people with Medicare. So all you have to do is call us or email us. In the next slide, I'll give you that information. So here it is. If you have questions, you can go to our website. We got a really great website, whatsmedicare.com. A lot of the things we talked about are on there. I've got some very short videos that explain some of the parts of Medicare. You can also email me, jim@whatsmedicare.com. There's our contact information along with our local and 800 numbers on there. And we look forward to being of service. Feel free to call with any questions.